So I've been a nurse for 4 years now.
So I didn't become a nurse until I was 30.
I don't have the revolutionary story most people have.
I appreciate the opportunity to tell the story of the nurse, or should I say one of the stories of the collective that is the nurse.
Nursing was pretty much my first career choice.
The second career for me, I wanted to have meaningful work and also work that met my lifestyle goals.
Ever since I was young, I've always been interested in, I guess not just in nursing, I was always interested in trauma.
I shadowed an ER doctor.
I used to watch Trauma Life in the ER.
And I ended up being more interested in what the nurse practitioner was doing.
My parents joke because they don't know where I get it from.
I was in my mid-20s and needed to find a big girl career.
I was pursuing actually counselor type of role for troubled teens.
I applied to nursing school and I got in.
And I felt like I wasn't going to be able to make the measured difference that I thought that maybe I could make in nursing.
To work with people during some of their most intimate moments, getting to know them, their stories, what motivates them, what they are fearful of.
Showing up for someone who's experiencing the worst day of their life or feeling powerless in the healthcare setting and being able to use my skills to lessen that experience of crisis for them.
I think that there's something innate about being a nurse and the way in which we're taught.
Because nursing's a really unique field in that you're not only working with people on a very personal level, but you also get to use the input of science, and it was the opportunity to bring two worlds together, a personal, intimate world, along with understanding of the human body.
And it's an art form over a medical science. It's like the medical science is one of the backbones, but there's a layer of art that essentially encompasses the being. I can remember when COVID first came out, and a lot of us were extremely scared.
It was like out of the blue, and immediately things started changing.
A couple images just popped into my mind of a free fall and a explosion.
We were scared because there was so much we didn't know at the time. Family members, patients who were awake enough to have the TV on were glued to the news in February, I guess. It's broadcasting these images of what seemed like everybody in Italy dying. And at first, I think there was a little bit of denial, even amongst the nurses and the doctors being oh, that's happening there. That can't come here, right? And then it became increasingly apparent that it was going to come here.
As you can imagine, being a nurse and seeing the things that we've seen, specifically in the space of a lot of people collectively dying, I feel like there's been imprinting that I won't ever forget.
We could see how bad this virus was, but until you're there in the hospital and you're dealing with it, you have no idea what to expect. We never dealt with anything like this before.
The pandemic was a slow unraveling, really entering a space where no one had the training and coming to the realization of, oh, this isn't a sprint, this is a marathon.
We didn't know what we were dealing with, but we knew we were the place that had to deal with it. There wasn't very clear information on how it was transmitted yet and who its worst victims were going to be. We definitely knew we were putting our lives at risk and our families' lives at risk.
There was a lot of confusion of roles and who could go in the room, who could do what PPE do I really need.
A policy in the beginning of the day was different by the end of the day because it was so new.
There was this very specific day when it all became real. Someone had become unresponsive in the waiting room. This person had actually gone into cardiac arrest. They're pushing the stretcher down the hall back to the ER. There was a nurse on top of the patient straddling them, doing chest compressions while they're moving the stretcher down the hall. No one had any kind of protective equipment on. This was at the very beginning of the pandemic, and after we did all of that, we found out that the patient had COVID. I remember almost having an anxiety attack. I couldn't focus. I was shaking. I was like on the verge of tears because everyone was like, oh my gosh, we all just got exposed to this deadly disease. Are we gonna die?
People were just getting sicker and sicker and sicker. We were seeing patients, young patients too, in their 20s. So it was very scary, and we didn't have the support really. Our respiratory therapists were really spread thin. So we kind of had to fill in the gap and become the respiratory therapist as well. Once they got to that level of care, they really should have been going to the ICU. And ICU is only accepting them if they had to be intubated. We kept seeing this pattern happen over and over and over again, and seeing these patients rushed off the ICU and knowing that they might not make it, and they don't know. That was the hardest part. The patient has no idea that their chances are so low.
I'll never forget my first COVID intubation. That was a rapid response, was a young guy, and he had no past medical history. And I stood there and held his hand and told him it's going to be okay. And 2 weeks later, he was dead. I was one of the last people to talk to him and to tell him it was okay, and it wasn't. I feel guilty about that. I've had very few moments that will bother me for the rest of my life, and he's one of them.
We were sectioning off portions of the ICU where basically that was the designated, hey, you have been discovered to be a positive patient, you will be in this positive pod, and your nurses will basically exist in that pod with you. Soon one pod became two, became the whole ICU, became two ICUs.
It was simultaneously frightening, but also weirdly calm. What was weird about this form of chaos is there were no family members anymore. Staff were brought to a minimum, and everybody was intubated. So there was nobody talking. The only voices were like those of your coworkers. It was eerily quiet.
There were times when you're in isolation rooms and you can't hear anything. All you hear is this big negative airflow fan.
And whether you were in the room or not, if something happened that seemed like the patient was going to go downhill really, really fast, if you were outside the room, you can't just run in. And you're watching them drop and drop and drop as you're trying to get all of your stuff on. And if you're in the room, you're by yourself in the room. And usually people would be running in to help you. And then you push the call light, hoping that someone hears it.
And me having to take all the PPE off and wash up and then run into the other room. All of your other colleagues are in their rooms.
There's fewer people, the roles are different, the medicines we use are different. All of a sudden, that procedure that you can do with your eyes shut is different. And now you don't know what to do. But if you don't do it right now, this person will die.
We're bouncing from one room to the next, to the next. You could have somebody that just passed in one room and then go on right to another room.
And your patient dies and the body's not even off the bed and they already have another person assigned to your room.
This is just the first of many, many awful stories. I think the one that sticks in my mind, the one who affected me most profoundly, it was just when I had gotten back from a quarantine, and the unit was, it was rough. For lack of better words, I've become known as one of the cowboy nurses who will just go into the worst situation and be like, okay, let's see what we can figure out. This time I didn't think I was walking into this bad of a situation. But it was a 33-year-old young man. It was his birthday. And I walk in and I knew he was sick. His blood pressure was awful. Barely enough to supply enough blood to his brain and heart. He was already ventilated and on what I like to call jet fuel, medicines to keep his blood pressure up. His kidneys had failed, and so he was on a continuous dialysis machine. And I walk in, and immediately I was like, oh no. I don't know if I'm going to be able to get this guy to make it through the next hour. And so I call my docs in, and I'm like, hey, you guys, like, I know you haven't talked to each other yet. I know you haven't rounded yet, but I need you to come now because even with my arsenal of drugs, I can't keep this guy going. And with COVID, there's a high propensity for clotting. There's this intrinsic coagulopathy that just some people get really bad and they end up with these really bad, gnarly clots, either in their lungs or their legs or arms. And the suspicion was he had developed one so severe right in the center of his lungs, where basically the blood flows into both of your lungs, that it was preventing flow into his lungs and therefore back to his heart and to the entirety of his body. And so my fellow came in and helped me push some drugs that are really heavy duty clot busters. And it didn't work. And he's actively passing. And we called his parents in. You know, this is 10 in the morning now. And I'm pushing, in addition to the jet fuel I have running through him, I'm pushing other drugs just to try to keep him going long enough so family can come in. And his mom and dad come. I just remember throwing gowns on them and telling them, get in, he's dying. And as soon as they walked in and held his hand, that was it. And it was just one of the saddest things to watch a parent walk into a room for a son they haven't seen in a month. And he's swollen. And he's not who he was. And I had no time to prepare them. Literally, there was nothing I could do, or the doctors. And it just sticks with you. His wife came in. She was so kind. She said her goodbyes. And this guy, she was like, he was so afraid of catching it. He was just trying to make a living for our family. I think that was the first time that I realized that we weren't going to get out of it anytime soon. And this was just going to be our new normal.
As case numbers went up and up and up, we were doing more with less.
As you can imagine, to experience somebody dying actively while their family is on Zoom has to be one of the most empty and saddening things that one can experience. We're moving into a place that words don't do any justice for. That was essentially every day. That is miserable.
I think my throat was like tight all the time. This is the time more than ever in my career that people need other people to sit down and be present. And having that taken away felt unbearable, just a heavy pit of grief.
It was heavy to have somebody, like a phone on speakerphone, sitting next to them while they're unconscious and intubated, yelling through 2 masks and a face shield to get them to hear you over the sound of monitors and the ventilator and all this other stuff. Hearing their loved ones beg for them to get better. And you kind of knew that wasn't going to happen. It's really hard to demonstrate an earnest care and sympathy and empathy over a phone. I'm doing the best I can, but all I can see is how much I'm letting people down and how much I'm not doing.
I was like the 4th most experienced person there. So I was taking ECMO patients a lot, which is when you have your lungs functioning outside of the body, essentially for you through a machine. In addition to other machines like the ventilator. Most of them ended up on a slow, continuous dialysis also. And from ECMO row perspective, you took care of the same patient for like 3 months. That got hard. I feel like what I'm supposed to say is that you feel like you're a part of their lives. You feel like you couldn't bear it because it was so sad, and you did everything you could, and you just want them to get better. And to a certain extent, I do feel that way. Like, you do know that you're a part of their lives, but their families don't know that. And when they call and ask for an update at 10:30 at night after you've been in the room for an hour, and you try to explain what's going on night after night, month after month, you can't even begin to explain what this person looks like. Seeing someone who is gaunt and skin is peeling and fingers are darkening from all the medications that we have them on, and they're hooked up to all these devices, and they look like they're sleeping, but they're not sleeping, they're sedated. And you see the patient, you see that they're suffering, but you also see after a certain point that there's no way this person is ever going to be the same again. And then you just get irritated. At least I did. They would get a little bit better, and then they would plummet. Half of them would like code and die and bring them back, and then they'd level out. And all at the same time, it's doing nothing, is what it felt like. We make one small change, hoping like we throw the right dart at the right target, and then we wait and we wait. And so this whole pandemic and taking care of these ECMO patients, the patients that most of them don't make it out, got to be very, very difficult for a lot of us. And for myself, it was infuriating. Ultimately, I think they could all pretty much be summed up as we had done everything and more 3, 4, 5, 6 times for months, and nothing was changing. We couldn't make any progress. We just kept taking 10 steps back. Eventually, finally, someone would finally say, there is nothing else that we can do.
We currently are experiencing extreme staffing shortages. And that's because people are leaving the field in droves.
There were definitely those who were
on board and saying, hey, this might not be what we signed up for, but we're here and we're going to try. And then there were those who said, this is too much. This is not what I signed up for. And in either picture, you can't blame the human.
It was very apparent that our healthcare system was not set up to actually take care of everybody. And to work in a system as somebody who feels like their calling is to be a healer, that was deeply disappointing. There's an element of anger. Why does this have to happen to all these people?
Still like we're living in a warlike system. Like we are still shoving people into closets because they so happen to have oxygen adapters. We are still putting two people where one person should be. Sometimes there's just not time or space, and you take what you can. And if you're really having a rough time, you can go and talk to whoever's in charge that day, and they will absolutely tap you out and make sure somebody's there for you.
I don't know how many other people have talked about all the death. It's not just that they died, it's how they died.
I was just seeing the toll that our system was taking on our caregivers, on our nurses, our techs, doctors, everybody. We were just all pushed to our limits, and that really took a toll on my mental health.
I can tell you most of my colleagues, that is part of their signature, is giving the most dynamite care. So when you don't feel like you could give all of your time and care to somebody, it eats you alive.
You don't feel resilient. You feel beat down. A lot of people have had almost like an identity crisis of like, I can't do this. What am I going to do next?
Every morning, the charge nurse would just thank us for coming back. And that was so meaningful to me, acknowledging that, like, yeah, this is terrible. And regular, sane people would not come back to this. This is not an okay place to spend your time. But you're coming back because you care, and thank you so much. That daily affirmation for me was such a big deal.
I just hope that once this settles, that we can reevaluate how we disperse nurses and how we attract nurses and how we retain nurses, so that maybe we're not in this staffing crisis again, that maybe we get people and we keep people, good people, and that they're not tempted to leave because it's more lucrative to leave. Maybe we make it more lucrative to stay.
I don't know when this staffing crisis is going to end. The burnout is just incredible.
The piece of this that's still hard is it's not over.
I don't know if nursing's ever going to be the same, honestly.
As challenging as the work is, it is also some of the most meaningful work that I've done.
The only things that we really got was a sign that had our names on it. Thank you for working during the pandemic. And then it was back to normal. Or, well, it wasn't normal. It was back to like...
You know, my career as a nurse, I developed nuanced ways to be able to like demonstrate caring.
And it's funny because when I'll watch sad stories on TV, I'm a blubbering mess. But I can stand in a room when a family's saying goodbye to their loved ones and not shed a tear.
Again, we just keep showing up.